So far, we have been looking at the first step in building a therapeutic alliance. Now we'll be diving into the second step, how to build a therapeutic alliance through patient-centered care and shared decision-making, as well as the third step, evaluating and reflecting using therapeutic alliance measures. These steps will be described in the form of a role play between a clinician and their patient. In the role play, we'll be showing you what patient-centered care and shared decision-making looks like and address measures that can be used to evaluate the therapeutic alliance.
Good morning, Ms. Woodley. Thank you so much for waiting. I know your hearing test took quite a while. Would you like a couple of moments to relax, or can we continue with the results?
No, I think I'm okay. We can continue.
Okay, so just to recap what you previously told me, your hearing issue has made it difficult for you to communicate with people, and you actually struggle to communicate when there's more than one person in an area because you struggle to understand what they're saying, and you don't like to continuously ask for repetitions because you feel that it makes you seem incompetent. Am I correct in saying this?
Yes, I'm just, at this moment, I'm tired and frustrated and just want to go back to what life was like before all of these hearing loss problems started.
Yes. I'm so sorry to hear this, Ms. Woodley. Would you like a couple of moments to uh, just like reflect before we continue?
No, I think I'm good. We can continue. Don't worry.
Okay, so just to confirm your suspicions, your hearing test did indicate that you have a hearing loss in both of your ears. But luckily enough, this type of hearing problem is easily managed. And I would really like us to work together throughout this entire process to determine the most appropriate management plan. So you will be working with me in making the decisions with regards to your management plan, because we would like to ensure that you are happy and satisfied with every decision made in the management plan, because you are the one who's going to be using it long term. And if you are unhappy, the chances of you using the management plan is very low, and therefore your therapy outcomes will be very low. So that's why we want you to be a part of the management team and the planning. Now, I know I've said quite a lot of information. Would you like a couple of moments?
No, I think I knew that this was coming. Like, I expected myself to have the actual hearing loss, but I don't think I expected to be involved in the hearing loss management. So I guess I'm looking forward to exploring all of these like treatment options together.
Yes, yes. I'm also looking forward to working with you. Like I said previously, you are the main and most important person with regards to the management plan, because you are going to be using the management plan. So that's why we are going to practice joint decision making, because we want you to be involved in all aspects of the management plan, because like I said, you're the one who's going to be using it. And if you are unsatisfied, you won't be using it, and therefore you won't get all the benefit from therapy. And therefore, I'd just like to inform you that I will be with you throughout the entire process of your management, guiding you, and I will be providing you with all relevant information so that you can make the best informed decisions with regards to your management plan. Yes. So without further ado, would you like us to go through a management plan for you?
Yes, let's do that.
Okay. Let's go.
Okay, so Caitlin, can you tell us about previous experiences you've had with patients?
Okay, so reflecting on my past patient encounters, I do believe that I have succeeded in developing a positive therapeutic alliance with the use of patient motivation and ensuring appropriate therapy outcomes. This has actually helped to ensure that the patient-clinician relationship becomes stronger and more positive. And I've seen the strengthening of this professional relationship throughout each session with the use of teamwork. However, I have encountered some challenges during the development of a positive therapeutic alliance. The first one being that many patients still have quite a conventional mindset with regards to the clinician-patient relationship, in which they want me to make all decisions with regards to their management plan. And this unfortunately does not help the therapeutic alliance, because the patient is the one that's going to be using the management plan. Therefore, they must be involved with all decision making and be happy with the therapy outcomes to ensure that they get the most benefit. Another challenge that I have encountered is feeling incompetent with regards to joint decision making or even supporting the development of goal setting. This is because although I have all the knowledge with regards to the therapeutic alliance and management plan, I am not yet proficient and experienced and actually properly fostering that relationship. The final challenge that I have encountered is the fact that patients are unable to identify goals which will motivate them with regard to their management plan, and this actually sets the development of an appropriate management plan back quite a lot because it's difficult for the patients to identify what they actually want from their overall management plan. And if the patients are not able to identify and join in the process of decision making, they won't get all the benefit from the management plan at the end of the day.
So, Caitlin, I know that clinicians need to use measures to see if there is progress following intervention. For example, clinicians do a hearing test on patients after fitting them with a hearing aid to see if their hearing is improved. So, what do you intend on using to measure the therapeutic alliance you developed with your patient?
Okay, so the very nature of the therapeutic alliance is reflection and continuous reflection throughout the entire management plan. And that is actually why it is part of the third step of building a therapeutic alliance. As continuous reflection actually ensures that the clinician is able to identify parts of the management plan which is working appropriately for the patient or parts which the patient is not succeeding in or even enjoying so that it can be adjusted appropriately. And this type of reflection is actually very useful for goal setting and ensuring continuous joint decision making. Now, reflection can actually be done closer to the end of the therapy session using a range of therapeutic alliance measures, such as the Therapeutic Alliance Scale for Children Revised, the Therapeutic Alliance Scale for Caregivers and Patients, and the Aphasia and Stroke Therapeutic Alliance Measure. However, as an audiologist, it is not appropriate for me to use these measures. However, they can be used as a guideline during my reflection with a patient regarding the success of a management plan. It's also important to note that majority of therapeutic alliance assessment tools or reflection tools are not appropriate given the South African context, as South Africa is a very culturally and linguistically rich country. That's why these measurements are mostly used as a guideline, because they are not validated in accordance with the South African context. And as a clinician working within the South African context, it is important for me to know that one of the main challenges is actually with regards to the timing in relation to validating all of these measurements.
We hope you enjoyed watching and learned the importance of therapeutic alliance measures, as well as patient-centered care and shared decision-making in building a therapeutic alliance. Please join us on our next video, where we'll be discussing the next 2 steps in building a positive therapeutic alliance during the intervention with our adult patients, specifically the importance of discussing patients' previous healthcare experiences and the value of clinicians who share a common interest reflecting with each other.